Hi, folks. This is Jerry Bouquot. I would like to thank Mandana for inviting me to make a short presentation of something that's simple but kind of interesting to me. Let me get right to it. I have something that we reported for the first time probably 10 years ago as a poster presentation to the American Academy of Oral Path. And since then, I've personally seen or collected about 8 cases, I believe. So we'll be writing this up shortly, but this is the first oral presentation, and it's a cute little phenomenon. It shouldn't be missed by anybody, but apparently we've been missing it for a few centuries. It's something that I call the Cementum Chalice. It is a little piece of residual cementum. You pull the tooth and the cementum rips right off and remains in the socket. And in this case, you can see there's been a little perioendo inflammation around it as well. But that's usually not the case. This is just a good example from a friend of mine, Dr. Whitaker here in Morgantown, West Virginia. It's a 49-year-old male. His tooth was pulled in our urgent care clinic. Dr. Whitaker was in charge of that, and his tooth was pulled about 7 months ago, and now he comes back with a little tenderness, a little granulation tissue around the area. And when the dentist looked into it, looked into the socket was still empty, and it looked like bony walls around it, just as if the tooth had been pulled less than a week ago. So that's the classic presentation. This one, as I said, is a little different because it's got a little granulation tissue on top and it's got this inflammation around. And here's the x-ray from 7 months ago. You see the outline is very much the same, and this tooth was removed for periodontal problems, and it was removed with no problem as far as our records show. And yet the tooth left half of it behind, half of the cementum behind. And here is what the cementum looks like. It looks like a little cup. Originally, I was calling it a cementum cup, but it doesn't sound very cool, so I changed the name to Cementum Chalice. And microscopically, it is exactly what you would expect. It's a full thickness of cementum. All of ours have been full thickness. And if you look at the cementum, the cementoblasts are gone. This has been separated from the tooth for some time, I believe. And if we look a little bit below that, we see the reason that this came off didn't come off with the tooth. This, I theoretically postulate that this was broken off. Somebody bit down very hard and the cementum broke off. And then as every bite afterwards, for probably years, put a little bit of movement onto that. It was an irritant, and it moved just a little bit, enough to cause some inflammation around it. And it couldn't move too much because there was an attempted repair. This is bone. So this is an ankylosed piece of cementum. And when the tooth was pulled, the bone was glued to the cementum. So easy enough to understand and easy enough to identify. Here's another case where the lesion, the cementum chalice itself, is still with the tooth. And we can see the tooth has a little bit of a lateral periapical granuloma or radicular granuloma, but it is definitely denuded down here, and denuded or degloved root is the term that I have used for it. And really, it is kind of the ultimate example of a term that we published the most histopathologic cases of maybe, 10, 15 years ago. And that was cemental tears. Cemental tears are another strange thing because they weren't reported till the 1990s. And they're everywhere. They're literally everywhere. And the same phenomenon, except that only a small area of cementum is pulled away. And this picture down below is a cemental tear that was up near the surface, as we see in the picture above. And there's some ankylosis here also. So that's why probably it broke away when somebody chewed too hard. It remained attached to the bone instead of the tooth. And this one was close enough to the surface to get some bacteria and some an abscess formation. And I have hundreds of teeth now that I've looked at, and this is a very common phenomenon. A piece of cementum has been broken off. In this case, it's been repaired, partially repaired by, I don't know whether it's cementum or bone, but there was attempted cover up. But most of them are just this ragged piece. And I think probably the ragged piece just hadn't been in place long enough to have attempted repair. So it's a weakness in the cementum dentin junction, whether it's developmental or not, or whether you just have somebody with a very strong jaw and they abruptly bite down and break the cementum away. We're not sure, but it makes sense at least. And usually cemental tears, I can't see them microscopically. They're in a location where they're not visible on the radiograph. But the chalice is pretty obvious, and we have one case that remained in place for over a year and a half. So interesting little phenomenon, easy enough to cure it out. No big deal as far as a lesion go, but why have we not seen this before? And as I've done for a long time since both of them died, I dedicate every CE kind of seminar to my two main mentors and wonderful people, Robert Gorlin in Minneapolis and Jens Pinborg in Copenhagen. I spent a fellowship with Jens. And I have, over the years, picked up quite a few lesions, just weird things that were never reported before. I've got 47, and there's a new one that I just picked up about a month ago, and I'll report that sometime soon. So if anybody is interested, I have a handout, or I have a PowerPoint of all of these lesions, and they're just kind of interesting little things. So, okay, all the best to everybody. Take care.